Hi, my name's Mary Brady. I'm going to be doing my IV competency. I have my MAR here for my patient Ellen Davies, birthday 919XX. She's 57 years old and her only allergen is to pollen. Her orders are for normal saline, 500 milliliters at a rate of 125 milliliters per hour IV. When you do the math using 15 drop per milliliter tubing, you get 31.25 drops or 31 drops per minute. Next is my cefazolin sodium, 1 gram IV piggyback in 50 milliliters normal saline over 30 minutes. When you do the math out for that, also using 15 drops per milliliter tubing, you're going to get 25 drops per minute. So before I get my medicine, I'm going to wash my hands here. I'm going to take my first med here. 500 milliliters normal saline. This one is open, but normally I would find one that was closed. So normal saline, 500 milliliters. My MAR says normal saline, 500 milliliters. That's going to be a rate at 125 milliliters per hour IV. The expiration date here looks good, and my solution looks good. No particles or anything funky about it. I'm going to use my primary IV tubing with that. It's 15 drops per milliliter tubing, and my expiration date on that is good as well. Next, I have my cefazolin sodium, 1 gram in 50 milliliters normal saline. Compared to my MAR, cefazolin sodium, 1 gram in 50 milliliters normal saline, IV piggyback over 30 minutes. My expiration date is good on this, and my solution on this looks clear and nope, nothing wonky there. I'm going to use a secondary tubing set with that. Also 15 drops per milliliter tubing, and my expiration date is good. Now I'm going to go see my patient. Hi, my name's Mary Brady. I want you to know that we're in a private room. I'm going to wash my hands. Can you tell me your name and date of birth, Ellen? Ellen Davies, 919XX. Birthday is, she's 57 years old. Ellen, do you have any allergies? Just to pollen, that's great. Just so you know, I have some IV fluids for you to help with your hydration. And I also have one med called cefazolin sodium. It's going to go run through your IV for 30 minutes. But you shouldn't feel any pain or anything with that. And it's all going to go through your IV. Before I start anything else, I'm going to wash my hands again. I'm going to start with my primary fluid here. I have a trash can on the floor here. All right, my patient Ellen Davies, 919XX, 57 years old. That's who I have here. Your only allergen is pollen. I'm going to be giving you normal saline, 500 milliliters, compared to the MAR, normal saline, 500 milliliters. Again, I'm going to give that at a rate of 125 milliliters per hour. I'm going to be careful with my tubing here, not to touch this here while I check the rest out. I'll pull this off, careful not to touch anything. And then my cap off. Stick that in there. And hang that. Now I'm going to prime my tubing. And I'm going to fill here halfway up. And before I filled it up, my clamp is closed here. I don't know if you can see that. So I filled the chamber up halfway. Now I'm going to slowly fill the rest of my tubing here. I'm going to go slow so I don't waste any and I don't get any air bubbles. Alrighty. So now that my tubing is primed, I'm going to check my MAR one time more time. Sodium chloride, normal saline, 500 milliliters. That's what I have here. Normal saline, sodium chloride, 500 milliliters. I am going to wash my hands. I am going to put some gloves on. I am going to check my IV site. No pain or swelling or redness. Ellen, do you feel any pain? No, that's great. I'll take an alcohol swab here. I'm going to clean the port for 15 seconds. And I was careful, this is still clean out of the package. I haven't touched it to anything. I'm going to connect it there. Unclamp my IV site if it was clamped. And now I'm going to take my gloves off. Wash my hands again. All right, the sodium chloride 500 milliliters needs to be a rate of 125. That is 31 drops per minute. I'm going to watch my chamber here. All right, I'm going to start counting. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, and that is a minute. So I'm at 31 drops per minute here. Next, I am going to wash my hands. I'm actually going to, because this isn't a real patient, just clamp my primary tubing here so that I don't have a mess. I'm going to do my LES check. Cefazolin sodium 1 gram in 50 milliliters compared to my MAR cefazolin sodium 1 gram in 50 milliliters normal saline. I'm going to label my medication here just so everyone knows what it is. I have my secondary tubing. Careful when I open that not to touch anything to the spike or the end. I'm going to clamp my tubing before I spike it. Careful not to touch anything. Alrighty. Fill my chamber here about halfway. And I'm going to do this very slow as not to waste any of my medicine. And I don't want any bubbles in my tube or anything like that. All right, now that that is good, before I connect, I'm going to do my another check. Cefazolin sodium 1 gram in 50 milliliters normal saline on my MAR. Cefazolin sodium 1 gram in 50 milliliters normal saline. That's going to be given 50 milliliters over 30 minutes. That's a drop factor of 25 drops per minute. Now that that is on, I'm going to wash my hands one last time. Put some gloves on. I want to check my site again before starting a new medication. No redness or soreness. Ellen, do you have any pain or any questions about the med? No, that's great. I will take my gloves off. And I will clean my hands again. I have already clamped my primary tubing. And I'm going to hang it lower now before I set the drip rate. I am going to take another alcohol swab. I'm going to clean this Y port here for 15 seconds. Alrighty. Careful to keep that clean, not touch anything. I'm going to connect the two. All right, as of right now, both of my tubings are clamped. I'm going to completely unclamp the cefazolin, and I'm going to set the drip rate at 25 drips per minute using my primary tubing clamp. Alrighty, I'm going to start counting now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. All right, so I'm a little slow. I'm going to have to count again. Start again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, and that is a minute. So we are at 25 drops per minute. now that that is set, I'm going to wash my hands one more time. I'm going to put on some new gloves. I'm going to assess my IV site. No redness, no swelling, no pain. Ellen, do you have any pain or anything you need? I'm going to take my gloves off. I'm going to wash my hands one more time. Ellen, do you need anything else? You've been in a private room the whole time, so you had privacy. I'm going to make sure you're in a safe location. The bed's down. You have a call light if that's available. And lastly, I'm going to document. Do you need anything else? No. So that would run the for 30 minutes as that, and I would document. So I think that's all. Thank you.